Every sensor looks like this.
Dr. Emily Van Klompenburg is a pharmacist in Brookings who teaches patients how to monitor their blood sugar with a continuous glucose monitor.
It is a little system that we wear on the back of our arm that actually threads a little catheter underneath the skin that actually wicks up a different reading that's going to give us our blood sugar.
This monitor is applied in the fatty tissue region of the arm and monitors blood sugar levels more consistently than the classic finger poke.
So I only know what your blood sugar is exactly at the moment when you test your blood sugar through a finger poke. The nice thing with our glucose monitors is that we start seeing trends where it measures the blood sugar once every 5 minutes or once every minute.
This helps the patient with accurate, real-time data. Dr. Van Klompenburg can see if food, exercise, or certain medication has dropped or spiked the blood sugar.
And then we're able to figure out what medications or insulin doses work best for that patient in that season of their life.
A pharmacist will help with the initial application, but the patient can take over once learned. This particular monitor lasts anywhere from 10 to 15 days and can be customizable for certain alarms like blood sugar spikes or when the monitor needs to be replaced.
Within the system, either the smartphone app or within the receiver, the patient will get alarms saying you are due to replace your sensor, and then they can replace it when it actually makes sense for them.
Dr. Van Klompenburg says these monitors are extremely accurate for checking blood sugar, especially for patients who have good blood sugar control and a low A1C.
5.5 and maybe up to 8, it is very, very accurate. It's when we get to someone who has really, really high blood sugars that sometimes we find that it's not as accurate, but also admitting that when someone has really high blood sugars, as a clinician, I'm going to note that as high, not as this is something I specifically need to look at that exact number. So I'm able to adjust medication still based off of that.
Dr. Van Klompenburg says the continuous glucose monitoring systems have been receiving better coverage by insurance and are becoming more affordable to people who need it.
For 2024, for South Dakota Medicaid, if you are on short-acting insulin or mealtime insulin, a continuous glucose monitor is covered. The other side is if you're on Medicare and on any type of insulin, generally these agents are covered underneath Medicare Part B.